Welcome to your medical unit huddle for October 25th. I'm Ricky, your nurse manager. Last week I was gone in Chicago for my last AONL conference, and I want to thank you guys for holding down the fort and continuing to give our patients great patient care while I was gone. And so I'm all finished with the fellowship, and I am back full force and ready to focus in again on the team. So with that being said, I want to talk about bedside report. I just want to be very, very clear, and I've been very generous about it. This is not an option. Bedside report has to happen. This gives you the opportunity to go in, say hi to the patient, manage each other up. It gives you an idea too of what the patient may look like, and gives you an opportunity to set up your next shift for success. Maybe you realize that you let an IV bag run dry, or that maybe the patient does need some attention because they've been incontinent or something like that, and then you can get good help in right away as well. It also cuts down on the animosity. It's not fun sometimes to, discover something that a nurse may have had to leave behind for whatever reason, or did leave behind for whatever reason, and then you're like, oh, I hate following so-and-so because they always leave my patients a mess or something like that. So the best thing to do is to be in the moment and do the bedside report. Again, it just really is a good opportunity to meet that patient, and that you guys have both laid eyes on that patient, and it's not a surprise when you walk in, because I certainly have been in that position, and sometimes it doesn't feel very good. And that's not just the point either, so you guys get what I'm saying. Just make sure you guys are doing that bedside report. Again, it's not an option. Feel safe to hold each other accountable, that if someone is refusing to do bedside report, or they're saying nah or no, we don't need to go in there, it's safe to be assertive, or to pull that person in there with you. And if they continue to not do that, I encourage you to let your charge nurse know, and of course always let me know, so we can handle that. That is, again, the expectation and the standard of practice here, not just on the medical unit, but it really is our standard practice here at Medical Center of the Rockies. Done. All right, so coming into cold and flu season, I just want to encourage you to keep the unit tidy, and maybe bleach down some things if you get a chance. It really is best practice, or something that we did a couple years ago, is that at the end of your shift, you set up at your nurse server or whatever, is that part of shutting down the shift, if you will, is bleaching your station. So maybe let's get in the habit of doing that here in the next couple of months. People are already starting to feel crummy and calling in, so we want to just kind of keep our space as clean as possible. Same with patient rooms. It's always best to keep the rooms tidy, and get rid of trays if they're on the counters, or linens are balled up. I feel like I repeat myself with this kind of stuff, but anyway, it is super important to make sure that we take pride in the place that we work, right? Okay, what else is on my list? Our medicine service line safety huddle report out from Carly. Last week was about the tele boxes. We are aware that there seems to be a shortage, or boxes are missing and that kind of thing, so I just want you to know that I am aware of that, and I am working with other managers throughout the house to either locate those boxes, or to come up with a plan to ensure that we have enough tele boxes house-wide. Really, it's not just us that's kind of going through this little bit of suffering. Lucky us, we have Visi, and so every patient has been on Visi, nearly. We had like 16 patients on the other day. Thank you to Jess Young, and to Shannon and Nancy and Kari, and everyone really putting our patients on Visi, or keeping our patients on Visi. So you guys keep it up. Nurses, don't let us fall out by saying my patient doesn't need to be on Visi. We have different ways that we can utilize the device. And so I know, again, a lot of our PCTs have championed having the patient on Visi and on Tele, and it really has worked out just fine. Patients, I haven't heard anything, and it really is a good transition. That was another point that was brought up, was that when the patient does come off Tele and they're already on Visi, it really is a smooth transition versus they're off Tele, now they have to be on another device. So anyway, thank you. And so this week, something that has come up is that if patients are refusing high fall risk precautions, they cannot refuse to use the chair alarm or the chair pad. Please let your charge nurse know, or let me know if you have a patient who is refusing high fall risk precautions. And then, what else? I think that was it. Okay, so we have Brittany, who is a part-time night shift nurse that is starting with us on the 28th. If you see Brittany, welcome her. And again, everybody's doing an amazing job. I really am just super proud of our team and all of the work that you're doing for taking care of our patients. We really do have the best team in the house. All right, I'm going to turn it over to your charge nurse for any current patient safety quality concerns. And as always, I hope you guys have a great shift.